Right. This is a slightly more difficult case, okay? This is a 65-year-old man with previous inferior STEMI treated with primary PCI. There was significant bystander coronary disease. He was lost to follow-up, and he represented because he was having ongoing chest pains and breathlessness and some other symptoms. He also reported having low-grade fevers a few weeks after the EMI. He had no new ECG changes, and he was troponin negative, okay? So let's load this study, please.
Okay, 2026 Hygeia AV13CCTA.
So here there's a number of findings, okay? There's definitely important findings from the coronaries. In fact, there's a CTO of the LAD. Let me show you the LAD MPR. Okay, so that's the LAD, which is occluded at the mid segment. And as previously mentioned, you can see this contrast filling the distal part and this rag sign. So there's definitely some collateral circulation there because there's opacification of the distal segment past the occlusion. So there's, yeah, CTO of the LAD. And then if you look at the circumflex, there is also significant stenosis in the atrioventricular part of the circumflex, in the AV circ. You see there is mixed plaque. Okay. I move faster because this is important, but also there's something more important that we don't have a lot of time. Also, if you look at the obtuse, there's a large marginal branch that comes off this circumflex, which seems unobstructed. Okay, that's the OM, and it's patent. And last artery to assess is the RCA. Okay, and the RCA looks patent as well. The stent, difficult to assess. It's a small stent. It's placed distally. I don't want to commit to an answer, but probably looks grossly unobstructed. But as I said, this is not the main focus of this case. But this patient has got significant disease, has got CTO of the LAD, severe circumflex stenosis. He's got symptoms. I want you to go back to your axial images and see if there is also something else going on, okay? So scroll up and down and see if anything draws your attention apart from the coronaries, okay? Yes. Is it fluid or thickening? How many Hounsfield unit is it? So yes, this is pericardial thickening, okay? If you check the Hounsfield units, there's the polygon. Yeah, this is 53. This is consistent with thickening rather than fluid, okay? So this may well be contributing to the patient's symptoms, and the patient has had, as we said, previous STEMI. He may have had Dressler. He had ongoing fevers after the STEMI. Now he presents with some chest pains, but dropped negative, no ECG changes, and he had on examination peripheral edema and hepatomegaly. So this could well be all signs of constriction. So what we did next, we did a cardiac MRI. I'll briefly show that as well because I think it's interesting. This is dark blood localizer haste sequence. Okay, gives good contrast between the fat and the pericardium. So you can see it's a bit thick in the pericardium there. Also, there is dilated IVC and hepatic veins. Okay, this gives some gross anatomical information, but you suspect there is a pericardial thickness from that sequence. And then you do this. You can do these real-time free breathing sequences. You get the patient to breathe in and out, and you see that this interventricular septum flattens with deep inspiration. Where is it? Where is it? There it is. Okay. So there's this this sign that can be suggestive of constriction, and then on LG you see that. You can see that there's an inferior infarct, as we said before. There was no real LG of the pericardium, but there was an inferior infarct. And then on T2 stir images, You don't see any high signal intensity, of the pericardium. So this is an LG negative, T2 stir negative, kind of pericardial thickening, which was causing constriction. So the decision was made to revascularize the patient, but at the same time, do a pericardiectomy because it was well past the onset of the symptoms. It was not treated. So it was all fibrinous, kind of permanent situation causing constriction. I actually may have a picture of the, yeah, that's how it looked, the pericardium. Yeah, when it was stripped off.
All righty.
Thank you.
Thank you. All righty, Tam.